So, assuming the patient has now come for labor and delivery, the nurses would have registered the patient already on the system. So the doctor comes to the doctor's side, labor and delivery, and let's say we have selected the patient. I've already pre-selected this patient who is in labor. So the vitals would have been entered by the nurses. As you can see, the patient is using the corporate insurance. With the labor and delivery, you can still see the A&C progress, the whole A&C progress of the patient if the patient came for antenatal clinic. You can see the past obstetric history. You can see the risk factors as we saw in the other place. But now there's also the partograph. So let's go back and start plotting. So let's start with the fetal heart rate. The time and date is pre-selected for you. So I'm going to enter an FH of 127. And then let's assume in a few minutes time, I checked the FH, another FH. So I now have two different FHs. The labor vitals is for the mother. I'm going to enter the temperature, the pulse. I'm just pre-selecting certain figures. The heart rate, if you measure the SpO2, the urine acetone, the urine volume, and etc., you'd enter it here. As the time goes on, you'd keep adding more vitals, as you know. Then the partograph. You have to enter the hours since active phase began. Let's say active phase began an hour ago, or maybe 2 hours ago. You would enter 2. The cervical dilatation at active phase. Let's say at the time you saw the patient, the cervical dilatation was 4. The system is made such that you cannot enter cervical dilatation below 4 because to use the partograph, the cervical dilatation must be 4 and above. So I'll just give an example. If my cervical dilatation is 3, the descent is, let's say, 4/5. Contractions in 10 minutes, 3 in 10. Duration of contraction lasting 40 seconds. The membranes are intact. Amniotic fluid, right now you can't tell because the membranes are intact. Molding, there's no molding now. You've not given any oxytocin, and if there are any drugs to be given, we've not given it yet. We've not given anything. Perhaps maybe just some IV fluid. So you may enter here normal saline. 500 mils has been entered. Then once you save, all these information should be plotted on the graph. Yes, remember I said you cannot use the partograph until the cervical dilatation is at least 4 centimeters. So the system would give you an error here. Cervical dilatation is less than 4 centimeters, so you are not ready to use the partograph yet. So now I can make my cervical dilatation, maybe at the time I saw the patient, I can make the cervical dilatation 5 centimeters. I'm going to add a second plot. Let's say it's 4 hours now, so this hours since active phase began will be 6. Now the patient is 7 cm dilated. The head is still at the same place. Contractions are now 4 in 10, lasting 60 seconds. The membranes are now ruptured, and the amniotic fluid is clear. There's no molding, and still I'm giving another normal saline. I'll check the mother's vitals again. I'm inputting another set of values. So once I save, I can look at the partograph below and see here, that's the FH. You can see the plots as we go on. If the FH is going up, the plot will go up. If it's coming down, it will come down. And here's our partograph. So far, we said the fetal head remained the same, so we can see it with this. And as you can see, the legend is here. So